Canada's police chiefs say they've been pushed to the front lines of mental health issues due to a lack of services elsewhere. And Winnipeg appears to be a clear example of that trend.
When I started in the police service 27 years ago, there were times when I spent an entire shift in the hospital with somebody who was mentally ill. That continues today.
Police blame a general lack of health funding and facilities for mentally ill people for placing them on the front lines of mental health issues. They say this taxes their already stressed resources and ties up officers who could be dealing with other matters.
More and more police calls involve the mentally ill. Now, many of you know that deinstitutionalization occurred 10, 20 years ago. It occurred in many parts of Canada. And a lot of people ended up in the community. And for some, that was a good thing. It worked. But for many others, they didn't get the supports that were promised to them, or it was inappropriate for them to be released into the community for treatment.
Chu said police must speak up and demand better programming and government funding to ensure police are no longer forced to serve as de facto mental health workers. But Clunas says work is underway locally to address that issue, with a comprehensive community health strategy labeled Live Safe being developed by a variety of stakeholders.
It's emerging as we speak. Pieces of it are actually in play already, and shortly I'll be coming forward and showing you the entire comprehensive approach that will be taken in terms of community health in the city of Winnipeg.
Clunas declined to elaborate on what elements of the program are already in place. The city's new Mental Health Crisis Response Center may be part of that change. Further details on the center's success, which officially opened in June, are expected next year. Joyanne Persega, Sun News.